Did you know that you have the power to fight one of the biggest public health challenges of our time? In my hand is a strip of antibiotics. These are medicines that are used to treat bacterial infection. And I'm sure all of us have taken a course sometime to treat a skin infection, a wound infection, a respiratory infection like pneumonia, or a urinary tract infection. These are wonder drugs. They've saved millions of lives ever since Alexander Fleming discovered penicillin in 1928 to say that if human beings misuse antibiotics, we may end up in a situation where they don't work anymore. And that's what's happening today. It's because we're taking antibiotics when we don't need them, we're taking them in the wrong dose or for the wrong duration, and they are losing their power. The bacteria are winning and becoming superbugs. I'm Soumya Swaminathan, and this is Science Simply. Let us begin by asking, what is antimicrobial resistance? Antibiotics are used to treat bacterial infections. So when we take a course of antibiotics, we expect that all of those bacteria will be killed. But always in any population of bacteria, there are a couple that are able to resist this antibiotic because of natural mutations that they have. Now, if we do not take the full course of antibiotics, or if we take a lower dose than what is recommended, we don't complete the course, then few of the bacteria that should have been killed will survive and will keep multiplying. And what happens then is that you end up with a colony of bacteria that are resistant to the antibiotic. So when this happens at the population level, you get a lot of bacteria that are becoming resistant to the drugs that we commonly use, and in fact we can call them superbugs. They are very smart and they accumulate mutations to make them resistant to multiple drugs. And then we end up with a situation where a simple infection that normally could have been treated easily at home with an antibiotic requires hospitalization, requires intensive care, and requires very expensive drugs to treat. Why does this matter? Well, globally, 5 million people die because of antimicrobial resistance every year. In fact, in India, it kills about 50,000 newborns every year because they get infected with infections which are very hard to treat with existing antibiotics. It is predicted that by 2050 we may reach a situation where antimicrobial resistance is even called a pandemic because the number of lives that it's going to take. And why does it happen? It's because we don't take the right medicine for the right infection, for the right length of time, and at the right dose. In fact, we are overusing antibiotics when we don't need them. A common cold, a viral infection does not need antibiotics. In fact, it's not going to respond to an antibiotic. And our habit of just going to the pharmacy, purchasing drugs over the counter and consuming them haphazardly has led to this phenomenon growing. India is one of the countries in the world with the highest rates of resistance. That's what the ICMR's data shows. And it's because of the misuse, very frankly, of antibiotics. Antibiotics are also used for animals in the veterinary sector, in the poultry sector, in the agriculture sector, in aquaculture. And those antibiotics don't just remain localized in those ponds or fields or farms. They actually get into the soil, into the environment, into the water, and bacteria that are present in all of these places, they interact with each other, and sometimes the resistance genes jump from one bacteria into another. So it's a One Health issue. It's not just human beings that are involved. It is the use of antibiotics and antimicrobials across all of these sectors. And that is why we need to look at the problem also holistically. But here's some good news. There are simple things that all of us can do, and the most important one is prevention. If we can prevent ourselves from getting infections, then of course we don't need drugs to treat them. So simple things like washing our hands regularly with soap and water, wearing a mask when you have a respiratory infection, being up to date with immunization and vaccinations, ensuring that the food and water that you're eating and drinking comes from a clean source and is properly washed before it is consumed. So these are simple things that all of us can do. But also the medical profession and hospitals need to do their bit. So we need antimicrobial stewardship infection control committees in every hospital. These committees ensure that only the right antibiotic is used when it is indicated, that there is no overuse or abuse of antibiotics. There's an audit that's maintained. They look at the bacterial culture data as well. So every hospital should really have these infection prevention and control committees, and it's been shown that it has a very big impact, and every hospital should put out data on how much resistance levels they're seeing over a period of time. Similarly, pharmacists must be very careful. They should never hand over antibiotics over the counter. In fact, one way of recognizing a Schedule H drug is to see that there's a red box on the cover of the strip of medicines. Those medicines must never be used without prescription by a doctor. And of course, people in the agriculture and veterinary and poultry sectors must not use antibiotics as growth promoters or as preventives. They must only use them for the treatment of known infection. Many countries are also now using the WHO's AWARE framework. This stands for access, watch, and reserve. So antibiotics are divided into 3 groups. The access groups are the commonly used ones, which should be the first line of prescription. And then you have a group of antibiotics kept in the watch. And then the third group, which should be very selectively and rarely used, is a reserve group of antibiotics. So I think all medical practitioners should be familiar and should follow the guidelines that are set out by the WHO, by the Ministry of Health and Family Welfare, by the ICMR for treatment of different infections. This kind of antimicrobial stewardship goes a long way in reducing AMR. We need governments to strengthen their defenses as well. So one is the surveillance systems, which tell us constantly what the rates of resistance to antibiotics are, both at the hospitals but also in the community. We also need the regulators to be very strict and to ensure that no antibiotics are handed out at pharmacies without a doctor's prescription. We also need to ensure that when antibiotics are disposed of, when they are expired or no longer in use, that they are not randomly thrown into the waste but are disposed of correctly. And Kerala's antimicrobial resistance policy, I think, is a very comprehensive example of how a state must regulate and oversee the use of antibiotic. The responsibility belongs to all of us. Antibiotics are a very powerful tool that we have for treatment of infections that used to kill people before the discovery of antibiotics. We should not come to the stage, which we will eventually if we keep misusing them, where infections become untreatable all over again. And so we must preserve the power of these medicines for our future generations. This is Science Simply. I'm Soumya Swaminathan. Thank you for listening.